Blood flow through body tissues, also called tissue perfusion, is necessary to deliver oxygen and nutrients to tissue cells, remove waste chemicals and gases from those tissues, exchange gases at the lungs, absorb nutrients from the digestive tract, and to help form urine in the kidneys. The amount of blood flow in those tissues is regulated both intrinsically and extrinsically. Extrinsic controls are those controls that come from outside of the cardiovascular system, like neural signals or hormonal signals. We've taken a look at a few of these in the past, and we want to point out here that these extrinsic controls normally regulate systemic blood pressure through sympathetic signals or hormones that can increase cardiac output by increasing heart rate or contractility, or directly causing the smooth muscle of the blood vessels to vasoconstrict. All of these factors affect the arterial smooth muscle to influence blood pressure. This helps to maintain a near constant mean arterial pressure throughout much of the system, so intrinsic controls can direct blood flow to where it is needed most, or can help direct blood flow in a local kind of way. Local conditions regulate blood flow independently of nervous or hormonal control. That is, they show intrinsic or autoregulation. Blood flow is regulated intrinsically by altering the diameter of local arterioles. The mechanisms of intrinsic control can be classified as either metabolic or myogenic. When blood flow to a tissue is too low to meet tissue needs, a few things happen. Oxygen levels decline, metabolic products accumulate and act as paracrines, or localized signals. These metabolic products include hydrogen ions from carbon dioxide and lactic acid, potassium ions, adenosine, and prostaglandins. These changes in levels of metabolic chemicals can directly cause relaxation of smooth muscle in the tunica media, and they can also cause the release of nitric oxide. Nitric oxide is itself a powerful vasodilator. By dilating those blood vessels, this can improve blood flow to those areas to help meet the metabolic needs of those tissues. As blood pressure rises, it stretches the smooth muscles of blood vessels like arterioles. Blood pressure too high can rupture capillaries. So smooth muscle responds to this stretch caused by increasing pressure by increasing muscle tone, which leads to vasoconstriction. This vasoconstriction decreases blood flow to the tissue. Reduced pressure has an opposite effect. Reduced blood pressure reduces the stretch on the smooth muscle of an arteriole. Blood pressure too low can lead to insufficient metabolism. So smooth muscle responds to this reduced stretch by reducing tone and causing vasodilation. This vasodilation increases blood flow to the tissue. If tissue needs more oxygen and nutrients than short-term adjustments can supply, then a long-term kind of solution to increase blood flow is needed. This can happen by a process called angiogenesis. Angiogenesis refers to the production of new blood vessels to send increased blood to a tissue. This is common in the heart when a coronary artery is partially occluded, meaning that it's delivering less blood to the muscular portion of the heart, so new blood vessels are formed to help increase that delivery. It's also common throughout the entire body of people living in high altitudes. Because they have less oxygen available and less oxygen in their blood, angiogenesis increases the number of blood vessels throughout the entire body to improve blood delivery and oxygen delivery. Angiogenesis is also common in cancerous tumors, where abnormal tissue growth is increasing metabolic demand, and because of that increased metabolic demand, it causes an increase in blood delivery to that cancerous tumor.